Okay, so you are experiencing morning sickness?
I can't keep anything down.
We're worried the baby's not getting enough nutrients.
Have you lost any weight recently?
No. I read morning sickness is supposed to subside after 12 weeks, but it's like something is rotting in my stomach.
Oh, I'm sorry to hear.
Sorry. Anxious about this.
Sympathy and digestion. Anytime I have something, Jeremy gets it 10 minutes later, 2 times worse. My back is achy, he slips a disc. I catch a cold, he has man flu.
The fever was real. The thermometer was broken.
Okay. All right. From what I am seeing, your baby looks great. The heartbeat is strong, measuring on track for 24 weeks. But I would like to do some labs, see if we can figure this out.
Thank you.
Okay, a few more deep breaths.
I thought the labs came back clean.
They did, but they don't test for everything. Esme mentioned this feeling of having something rotting in your stomach, and you were having symptoms too. So I thought there might be a chance that this is not morning sickness, that you're carrying a bacteria, H. pylori. Here, that ought to do it.
And how do you get H. pylori?
Usually contaminated foods, but it can also be transferred person to person through saliva, which is why I think you both might have it.
This is from that hot dog cart you go to at lunch.
Can't know that. Plus, I'm not going to apologize for having great taste.
Okay, well, we will need you to get tested as well. But the good news is, if it is H. pylori, a couple antibiotics can clear it up.
Fantastic. One more thing, though. Can H. pylori cause constant heartburn? I pound these things all day.
See? It's always worse for him. Man flu. All over again.
Okay, well, why don't I grab you a nurse and we will get you checked in.
Hey.
Okay.
That's it?
Yes, for now. There's no sign of gallstones, but I'm going to check your labs and I'll be back.
Thanks.
Hey, Trini. I need to get someone from GI down here as well as Dr. Kingston if she's available.
Dr. Kingston for the H. pylori case?
Yeah.
She has cancer?
No. But I think he does.
I don't understand. You think I have stomach cancer?
When we did your ultrasound, I saw ascites, a buildup of fluid in the abdomen, which is a pretty strong indicator. So I called Dr. Kingston and we did your CT.
Unfortunately, it has all of the markers of cancer.
And this is from the H. pylori?
H. pylori is very common. 1 in 3 people in the US has it. But most cases have no symptoms or they're mild and treatable like yours. There are a tiny number of cases that lead to gastric cancer.
And how bad is it? Is gastric cancer one of the bad ones?
It depends on many factors, and once we do the PET scan and the biopsy, we will know more.
Okay.
Is that the real answer?
No. The real answer is gastric cancer is a bad one. But you are young, and you are healthy, and I'm a hell of a doctor. I'm not going anywhere. We're gonna fight this.
Oh my God. This is all my fault.
No, this is not anybody's fault.
I trivialized what you were going through. I mocked it when this whole time
Hey, it's gonna be okay.
It's not okay. We have a baby on the way. What are we gonna...
Look at me, okay? Hey. We're gonna get through this, yeah?
Sorry.
We are.
I'm so sorry. I'm so sorry. No, I'm so sorry.
Guy was found floating in the river, face down.
No name?
No wallet, no ID, no cell phone. First responders thought he might have been trying to drown himself.
He looks suicidal to you? Good morning. I'm Dr. Ripley. And what would your name be?
Why am I wet?
Well, you seem to have been floating in the Chicago River. A bystander helped to fish you out.
That was awfully nice of them.
Yes, it was. Someone mentioned that you were limping. You mind if I take a look at your feet?
Nope.
Great. Scissors and hemostat.
Copy. There you go.
Thanks, Trini. But you haven't changed these in a while.
Wow. Would you look at that?
Hey, I heard you caught a guy with trench foot. Haven't seen a whole lot of that since like World War One.
Yeah, we didn't find much beyond the trench foot. Only thing on his exam was a diastolic heart murmur. Had CT and labs are all normal. Nothing to explain his amnesia on the medical eval.
No luck at all IDing the guy.
No. Doris spoke to the police. No record yet of any missing persons in the vicinity that match his description. And then, of course, is the question, is he of any danger to himself?
You know, I'm feeling kind of rude not being able to call you by your name. Should we just pick out a temporary one, you know, try it on for size?
Okay. I'm good with whatever.
Oh, come on, man, you gotta pick. It's your temporary name. The first thing pops into your head. No luck? Okay, maybe you can tell me what you were thinking when you jumped into the river today.
It's a beautiful day, isn't it?
Sorry, you mean that's what you were thinking then or now?
What?
It's a beautiful day.
Yeah, if you say so.
No, I was repeating what you said.
How long do you think this might take?
A dissociative fugue state. I mean, it tracks the amnesia, the wandering. But how does somebody even fall into something like that? Did he hit his head?
Doesn't necessarily need to be a physical trauma.
So how do you snap him out of it?
There's this technique called EMDR.
I read about this. Eye movement desensitization and reprocessing, right?
Yep. Had some success with it, but without knowing what triggered the guy in the first place, it's like could easily turn into a bit of a goose chase. You know, still no word from the authorities in terms of IDing this guy?
No, nothing.
The thing I'm wondering is if him ending up in the Chicago River was not a random event.
Maybe. Why?
There's this thing that can happen in a fugue state. It's called purposeful wandering. If you had to guess, how long would you say that our guy's had trench foot?
Given the skin deterioration on his feet, at least 3 weeks.
Fit young guy walking through swamp, wetlands is going to average what, like?
Distance?
Yeah.
Maybe 20, 30 miles a day.
So times a month, it'd be roughly.
He might have traveled up to 1,000 miles by now. So it looks like you and our happy wanderer have something in common. His name's Daniel, too. Daniel Hazuri.
Lieutenant Daniel Hazuri, to be exact, age 26, reported missing a little over a month ago from Naval Air Station Pensacola.
Approximately 916 miles from here.
Huh. Wow. Top Gun candidate.
Third-generation aviator, it seems. Father was KIA in the Gulf about 20 years ago.
That's odd. I didn't think they'd let you fly jets with a diastolic murmur.
Check him out with Pop. He was a cute little tyke.
I pulled that off his Facebook.
Okay, now that's interesting. Look at where this picture was taken.
Huh.
The Chicago River.
I think we can start to safely hypothesize that his journey here was not completely random. Learn how to not touch a hot stove because you're going to burn your hand. Your mind can learn how to repress certain memories if they're too unpleasant, right? And that can cause your brain to do all kinds of interesting things. In your case, Lieutenant, I think that it caused you to fully disassociate and fall into what we call a fugue state. Why is that funny? I'm just curious. Okay, if it is, I'm just curious why you're laughing.
You called me lieutenant. That's so ridiculous.
Well, you might think so now, but this dashing young fighter pilot, that's you.
So, what is this? It's a digital stethoscope. It's just like a regular one, but this one we can Bluetooth.
Yeah, can hear your heartbeat here. Let me just turn it up a little bit. What we're trying to do here is reprocess your memory circuits by introducing unexpected stimuli, hoping to, press a reset button that will allow you to access your memories. You want to give it a shot?
Sure.
How about you cross your arms like this, right hand on the left shoulder, left hand on the right, then just close your eyes and start tapping gently.
Like this?
Yeah.
It Did you turn up the sound of my heart beating?
I did.
I can hear a little whoosh now between the beats.
That's your heart murmur. Did you know you had one? Keep tapping. Your name is Daniel Hazuri, and you fly jets.
If you say so.
Your name is Lieutenant Daniel Hazuri. You have a heart murmur.
If you say so.
Your name is Lieutenant Hazuri. You have a heart murmur, and you fly jets.
No, I don't.
What'd you say?
I don't fly jets. They found a heart murmur at my last physical. Just an innocent one, they said. But how innocent could it be if they were forced to clip my wings? What happened to my feet? Where the hell am I? The funny thing is, I don't have any memory of ever being in Chicago before. I barely remember my father. This picture is pretty much the only one I have of the two of us together.
He died when you were pretty young, right?
Yeah. All I ever wanted to do with my life was to live up to his legacy. Make him proud. Feels like that's not going to be possible anymore.
Wait. How do you know? You got your whole life ahead of you.
We were able to contact your base commander, and he's going to send somebody up tomorrow to take you back to Pensacola.
I'm not sure I have anything worth going back to. I don't know, Doc. Being in that fugue state sounds pretty good right now.
1+ pitting edema bilaterally, no calf tenderness.
I'm just the oven. And favorite future auntie. It's Jacob's sperm in this 5'9" goddess from Harvard's egg. I swear she looks just like Beyonce.
Well, swelling can be a completely normal byproduct of pregnancy, but I'd like to do an ultrasound to check on the baby.
Of course, yeah.
And to be clear, my husband and I chose our egg donor for her scholastic achievements.
Total lie. He just doesn't want you to think he's shallow.
The aesthetics were simply a bonus.
This might feel a little cool. I take it you two have been friends for a while?
He's been stuck with me since first day of freshman orientation.
When she demanded I be her friend.
Best friend.
Is everything okay?
You said this was a single pregnancy?
Yes. A boy. Why?
I am definitely seeing a second fetus.
Shut up.
We're having twins.
Surprise. Yeah, the second fetus must have been hiding behind their brother during previous ultrasounds.
Oh, I can't believe this.
Would you like to know the second baby's sex?
Yes, please.
It's a girl.
Oh my God, we're having a boy and a girl.
We have to FaceTime Ryan. Ryan's the other daddy. He's on a business trip.
I can never remember. Is China 13 hours ahead or behind?
Pierce, wake him up.
Let's get a CBC CMP fetal echo and level 2 ultrasound.
Is something wrong?
Oh, given the new finding of twins, I want to make sure that the female fetus has a thorough assessment. The female fetus looks considerably smaller than her brother, right? She could have selective fetal growth restriction from twin-to-twin transfusion syndrome. Let me know when Dr. Asher's back from L&D. We need to loop her in on this.
I think we can rule out twin-to-twin transfusion syndrome. I mean, these babies both have their own placentas and sacs, so they're unlikely sharing any blood supply.
So what's causing the size difference?
Not sure. Can you pull up Olivia's last ultrasound? Oh my God.
What is it?
I see why they missed the second fetus on her prior ultrasound. It's not clearly visible yet, but I don't think that the female fetus is growth restricted. I think she's younger than the male fetus.
You lost me.
These are not twins. These babies are of different gestational ages, about 4 weeks apart, I'd estimate.
How is that possible?
I think that this is an extremely rare case of superfetation. Olivia became pregnant after she was already pregnant.
So after Olivia was implanted with our embryo, she became pregnant with her own biological baby?
Yes, exactly. Usually, the pregnancy hormones prevent the body from being able to get pregnant again, but Olivia's body managed to bypass that system.
I thought we agreed that you weren't going to sleep around while pregnant, and if you did, you would at least use protection.
Didn't sleep around.
Who's the father?
It's Zane. The dates line up with when we were on again.
Zane? Olivia,
Maybe you can sort this out later. There is more we need to discuss with you.
Your fetal echo and level 2 ultrasound revealed that the female fetus, Olivia's biological baby, has a congenital pulmonary airway malformation. It's a cyst on the lungs putting pressure on the baby's heart.
This is causing a buildup of fluid that your body is essentially mirroring, and that's why you're experiencing swelling.
Okay, so what do we do? How do we fix this?
Well, we can try an ultrasound-guided procedure to drain the cyst, put in a shunt, and relieve pressure from the heart.
And then the baby will be okay?
That's our hope, yes. But there are risks that the shunt won't work and the cyst will return.
And if that happens, what do you try next?
If this procedure is unsuccessful, it is highly unlikely that the female fetus will survive.
So this is the only option?
It's our best option.
There are other risks associated with this procedure that you both should be aware of.
What risks?
Any in utero procedure puts Olivia in danger of her water breaking, sending her to preterm labor. With your baby at 21 weeks and Olivia's at roughly 17, neither would be viable.
We lose them both?
I'm so sorry. We know that this is a lot to take in.
Olivia, I'm so sorry.
So, have we made a decision?
Yes, I want to do the surgery.
Okay. I've already spoken to our fetal surgery team, and there's an OR available in the next few hours, so we'll move you to pre-op shortly.
It wasn't even the most difficult part of my routine. I was just doing a pivot turn into an arabesque when I fell off the beam. This is gonna set me back months. So much for my big comeback.
Comeback?
I insisted Angelica take a break from gymnastics for a while.
Which I'm struggling to make up for.
It was taking a toll on her body, but actually I was more worried about her mind.
So the dizziness, blurred vision, when did that start?
24 hours ago? I guess it was more like a week.
Could this be a side effect of the Bomaline?
Well, it's possible.
Highly unlikely. Sorry to interrupt, Dr. Charles. We've just had very few documented side effects with Bomaline, really just fatigue and dry mouth. Have you been taking the medication at the same time every day?
I take it right after breakfast every morning.
Okay, well, seems like you're right on top of it. Dr. Frost told me that you ordered a serum retinol test for Angelica.
Yes, I had a hunch.
Results are back.
Whoa, 240. That is a toxic level of vitamin A, explains the dizziness and the blurred vision. Seems like we found our culprit.
Yeah. And it wasn't Bomaline after all. What do you know?
Is there a problem?
No, not at all. I mean, good catch. Vitamin A toxicity, pretty rare. I mean, certainly wouldn't have been my first guess, I can tell you that much.
Wasn't my first guess either.
Wouldn't have been my 10th guess. How'd you get there?
When I saw Angelica with her hair down, I noticed it was a lot thinner than I remembered. And she confirmed that it was falling out in the shower lately, so.
So you went into her room to flush her IV while her mom was out getting coffee?
What are you getting at, Dr. Charles?
Well, it's just a little curious. You know, you order a targeted lab for a very common substance that conveniently covers all of Angelica's symptoms and exonerates Bomaline for your trial in the process?
You can't be serious. You think I would dose a patient to protect the results of a study? Isn't the more likely explanation that Angelica or Terry are hiding something from us?
You know what? I'd like to think I'm pretty good at detecting when people are concealing things from me.
That right?
Yeah.
The only thing I use to enhance my performance is glitter, which is totally allowed, by the way.
How often do you use glitter?
Mostly just on competition days.
Had a fair amount of those recently, haven't you?
She's had qualifying events every other day for the past month.
Right. And do you mind me asking, what kind of products do you use to apply the glitter?
So much. Hair gel, body butter, eyeshadow, lip gloss.
Do you happen to have any of those with you today?
Yeah, in my bag.
Sodium hyaluronate, rosehip oil, shea butter, retinol, and tretinoin.
What's wrong?
Well, retinol is just another name for vitamin A, and tretinoin is actually the strongest form of it. Not supposed to be available for over-the-counter use.
More than half the ingredients in these products contain forms of vitamin A.
You know, it's unusual for your body to absorb enough vitamin A through the skin to cause toxicity, but can happen with prolonged use of high-dose topical retinoids.
I've been literally poisoning myself with glitter.
You have, but you stop using these products immediately, your body will clear the excess vitamin A in a matter of weeks.
I'm sorry that I accused you.
I get it. I went overboard last year.
He was running, tripped and hit his chin on a curb.
Okay. Hi, Lucas. I'm Dr. Ripley. We're gonna take you for a little ride, okay? On my count, 1, 2, 3. Lucas, you mind if I move this jacket a little just so I can take a look?
It might take him a minute to warm up.
Did he get overstimulated by all the Halloween costumes?
Northbrook doesn't allow costumes at school. Could I speak with one of you outside?
Of course.
Thanks, guys.
Lucas, I don't even know what to call it. He became extremely agitated and tried running away from school. Thank God he tripped. Northbrook Academy is on a very busy road. If he had run into the street, I don't know what would have happened.
I swear, are you aware that you're bleeding?
What? It's just a small cut. I didn't think it was that bad.
What happened?
Get away!
Lucas, I'm not gonna hurt you, okay? I'm a doctor. I'm here to
No,
help.
you're not a doctor. You're one of the bad people.
The bad people?
The monsters. You're all monsters.
Why do you think Lucas attacked you with scissors?
He didn't attack me.
Well, then how would you characterize what happened?
He was terrified, trying to protect himself.
Right. Terrified of
Me.
any history of mental illness you know about?
No, not to my knowledge, at least.
Okay. No recent injuries or any kind of health issues?
Lately, Lucas has just been a bit more subdued, down in the dumps, like not quite himself.
Interesting. And how long ago did you start to notice that?
A few days ago. We have parent-teacher conferences on Friday. I was gonna check in with his foster parents then.
Oh, how long has Lucas been in foster care?
Since he was 6. He's been with his current foster parents, Tim and Lisa, for about a year, I think. I've been reaching out to them, but it just keeps going to voicemail.
And does he seem pretty happy with them, you think?
It's hard to say. I mean, Lucas is one of those kids who rarely complains about anything.
Please don't hurt me. Go away. Go away.
Hey, you know what? Miss Herrera told me that you like to draw and that you were actually pretty good at it. Is that true?
Go away.
Okay, well, you know something I've learned about drawing is that if I draw a picture of something that I'm scared of, it can make it quite a lot less scary for me. Do you think that you might be able to draw a picture for me? You can just use my iPad, draw with your finger. You think you might be able to do that for me? Okay. Here you go. Don't look at me. I'm just going to hand it to you. Wow. Who is this?
you.
Now look, you don't have to look at me, and I promise I won't move any closer. Lucas, cross my heart, I'm not a monster, but I absolutely believe that when you look at me, that's what you see. Because I think that your brain is playing a trick on you.
Trick?
Yeah. And I'm going to prove that to you right now by taking a picture of myself. Now I'm going to show it to you. Here comes the iPad. It's okay.
That's you?
Yeah. Not a monster, right?
No.
PMO.
Will the distortions go away?
They will, and that can take anywhere from a few hours to a few weeks, but unfortunately, they're very likely to return, which is why I'd like to refer you to a colleague of mine who is a very skilled neuropsychiatrist, and he can help you put together a treat. What's wrong?
We'll certainly make the appointment, but, well, we don't actually know how much longer we're going to be in Lucas's life.
Yeah, we got a call from his caseworker, Sheila, last week. His biological parents are trying to regain custody.
We're going to fight it. We've started the process of filing for adoption.
Okay. You happen to know why Lucas was put in foster care initially?
Both of his parents are addicts.
Yeah, they claim they're sober now, that they're turning their lives around, and yeah, maybe they are, but...
Right. You think there's any chance that Lucas might know, that he might be aware that his biological parents are trying to get him back?
No, he doesn't know anything. We didn't want to scare him unnecessarily.
Okay. Look, I'm gonna hit the book, see if I can figure out a way to get Lucas a bit of immediate relief. Okay?
That'd be great, thanks.
So, green tinted glasses help with light sensitivity. So, ophthalmology had a bunch of these lying around, but it turns out they also help reduce distortions caused by PMO. Open your eyes, pal. Hey there.
Not scary looking anymore. You look just like your picture.
Just a little more handsome, right?
Huh? You look like Tim and Lisa again.
We are Tim and Lisa. Yeah. Honey, can I ask you something? Are you having trouble sleeping?
We won't get mad, okay? Remember what we always tell you. If you can't sleep or if you're having bad dreams, you can always come wake us up.
Lucas, I'm just curious. I've been wondering if maybe you might have heard Tim and Lisa talking to your caseworker, Sheila, about possibly going back to live with your mom and dad?
Baby, it's okay if you did. You can tell us.
I heard you crying and I just wanted to see what was wrong. I know I'm supposed to knock on your door, but...
But what?
I didn't want to, because that would be a mistake.
A mistake? Why would that be a mistake?
Because you're not supposed to bother people when the door's closed.
Who told you that? Your mom and dad tell you that? What else they tell you was a mistake?
I'm not supposed to talk about it.
Lucas, look at me. You are not going to get in any trouble, buddy. You are safe here. Do you understand me?
You won't tell them.
I swear.
Being too loud. Not cleaning up my toys. Or sneaking food.
And, what would mom and dad do if you made a mistake?
They would scream really bad words at me. They'd tie me in my bed. They won't let me have anything to eat.
Oh, baby.
I don't want to go back there. Don't make me go back there.
It's okay.
No, please, I want to stay here.
Let me guess, acupuncture?
Yeah, Gail Spinner, 43. She was mid-session when she fell off the table and onto her back.
How you doing, Gail?
You ever been in pain in 500 goddamn places at the same time?
Ready, on my count.
Holy pincushion Batman.
Be extra gentle here, please. Ready, 1, 2, 3.
Oh, I was on the table and I had this spasm. I think the technician put a needle in the wrong spot or something, and I just seized up and tilted over onto the floor, and now I look like a damn porcupine.
Let's get pickups and hemostats.
Yeah, and also, give me 4 milligrams of morphine, please.
Okay, easy there, Tiger. I don't like taking pain meds.
It's just this might be an arduous process. You may want something to manage the discomfort.
Except it makes me constipated. Like bad. Like an old cement mixer.
It's very graphic.
You're fun.
It's your call, but we can give you something to help with the constipation.
What do you say, Chuck? Should we let him fill me with painkillers? Read that for me, sweetie.
Oh, you may rely on it.
All right, let's go. Load him in.
All right, yeah, let's give her the morphine and 100 Colace, and you may want to loop Dr. Charles into this.
Gail, I'm Dr. Charles. I was hoping that we could have a little chat. Is now a good time?
Oh, I've already missed Price is Right, so why the hell not?
Mind if I sit?
Please. So, what is it that you would like to discuss with me?
Well, I gotta be honest, my curiosity is thoroughly piqued by your Magic 8 Ball.
Chuck.
Oh, there's a name.
Yeah, it was the only thing I can trust, so I figured you deserved a name.
Do you mind?
Please.
I used to love these things when I was a kid. So Chuck helps you make all your decisions?
No, just the ones involving other people.
Why's that?
Well, they can't be trusted. Look, I know people think I'm out to lunch making these big decisions based on a child's toy. It's just that people don't see things the way they are. They weigh their options, do research, consult with their friends and family, and still they almost exclusively make the wrong decision. With Chuck here, I leave it up to the universe. There's no lies, there's no misintentions, no stress, just fate.
I gotta say, you're making a very good case for Chuck. And yet, I mean, he did, I assume, help lead you to your acupuncture adventure?
Yeah, but the crazy thing is, the only reason why I tried that in the first place is to fix my back. It's been so stiff lately.
Yeah, it says in your chart that it was a back spasm that made you fall off the table. Can you tell me a little bit more about that? I mean, the spasm specifically?
It's like if you're half asleep and you have a nightmare, but you jump in real life.
Yeah. Okay.
Does that mean something to you?
I don't know. It might. It might. Okay. So.
The overall pattern suggests corticovasal degeneration.
What? The others know. There's no evidence of cortical atrophy.
Not yet, but I see decreased activation in the parietal lobe and the motor cortex.
Minimal, maybe. I mean, well, Theo, that's a death sentence. You know that, right? So, like, what are you seeing? What are you looking at that I'm not? I mean, how do you know?
Because I've created a profile on how this disease presents in early stages using thousands of images and tests from other patients. And that's what it looks like.
So that's it for me then, huh?
I know it's really hard to hear. And, I'm just so sorry.
Well, how does this happen? How does it work, this whole basal cell thing?
Well, it causes shrinking and atrophy in portions of the brain over time, but right now, it's only affecting the motor pathways, which is why you have muscle spasms and weakness.
But the positive piece is that because of the cutting-edge work that Dr. Robari does here at Gaffney, we caught this much sooner than we normally would have, so we can immediately start treatments that will hopefully slow the progression of the disease.
Slow, not stop, not cure?
Unfortunately not.
But why is that? I mean, why is there no cure?
Well, complicated question, but fundamentally it's because it's still exceedingly rare.
And though doctors, including myself, are working on a cure, and eventually we will find one, the funding just isn't in place for it to happen anytime soon.
Not fast enough to help me.
Right.
What if I were to chip in?
I'm sorry, I don't know what you mean.
What I'm saying is, if I were to give you money, can you find the cure?
That's incredibly generous of you, but unfortunately, the funding required for this kind of research is just, it's really quite substantial.
Well, I can give you 150 million. Would that work? So, you guys gonna take my money and cure this thing or what?
If you would like to make a donation, we will put every single penny into finding a cure for CBD.
We will create a multi-team, multi-front assault, a global consortium of experts with neurologists, immunologists, geneticists that will allow for dozens of simultaneous clinical trials for new drugs. We will move at warp speed.
Ooh, and find a cure.
Eventually, yes, we will find a cure. I know that.
But fast enough to save me, right?
Unfortunately, we cannot guarantee that.
What, you can't?
Look, if anybody's going to do it, it's going to be Dr. Abari and his team. And as far as research timelines go, they are close. But are they close enough to help you? We just can't, in good conscience, promise you that.
I still urge you to consider this donation. You will save thousands of lives in the future and create a legacy for yourself.
Okay, I get it.
Look, you've got a lot to think about. So why don't we give you a little time?
You know that's not how it works. Even though I appreciate your honesty, I'm gonna have to lean on Chuck here.
I'm sorry, you're gonna let a 8-ball decide if you give us $150 million?
Of course. I can't chicken out now just because there's a few more zeros involved. All right, Chuck, this is a biggie. Do I give all my money to these men right here?
I woke up today without $150 million, and I will be going to sleep without $150 million. So nothing changed.
Then why does it feel like I just got sucker punched?